Well, good morning, ladies and gentlemen in the United States, and good evening to our dear friends in China. And for those of you I've not had the honor to meet yet, my name is John Allen, and I'm the president of the Brookings Institution in Washington, D.C. And let me just comment that watching this group assemble on the screen this morning before we kicked off the formal event, it was very heartwarming to see. It looked almost like a family reunion with dear friends once again coming together on an important subject and an important topic. So on behalf of my colleagues at Brookings and in our John L. Thornton China Center, I'd like to begin by offering my profound thanks to this incredible group gathered here this morning, this distinguished public health and medical experts who are joining us today. 1 month ago, Brookings convened a roundtable discussion with officials, advisors, and public health experts from the Biden administration and China, some of whom are here with us again today. And through that discussion, we saw a strong commitment to exploring possible U.S.-China collaboration to address the pandemic. Through that convening and our event here today, we want to take advantage of the change in administration in the United States to set a new course for how the United States and China can each address the shared threat of COVID-19. We want to do this by looking into the future, not dwelling on the past. Without a doubt, clearly the US and China relationship is experiencing a low point. But the presidential transition from Trump to Biden in the United States offers us an opportunity for leaders on both sides of the Indo-Pacific to examine what can be done differently. As the Biden administration has made clear, when it comes to issues of our time, there is nothing more important to that administration than bringing the COVID-19 pandemic under control. No country will be able to accomplish this on its own. It will only be accomplished through coordination. As part of the domestic response, President Biden has issued an executive order condemning and combating the racism and the xenophobia that has targeted Asian Americans and Pacific Islanders, and through typically references in the last administration to COVID-19 pandemic by either nicknames or geographic location of its origin. We're very pleased that he's taken that action because we have to act against the racism and xenophobia as a nation. But there are also practical reasons for the United States and China to coordinate our efforts. And I hope that today's event will present these practical, actionable steps to our leaders in both countries to help them take steps to save lives within our borders, but very importantly, beyond our borders. And we want to talk about three areas in particular: medical and research cooperation, vaccine development and distribution, and cross-border travel and global collaboration of public health progress. Collaboration that we're pursuing is not new. The US and China have a long history of working together to combat disease, from SARS in 2003 to H1N1 in 2009 to Ebola in 2015. That's a long history of constructive and productive collaboration. When China and the United States join forces to fight COVID-19, the world will have a better chance to emerge from the pandemic stronger. But if these two great countries fail to take action together, the world will in turn become weaker and more divided. So we will today, with a keynote conversation, begin the session, which will be followed by an expert panel. And we welcome the viewers to submit their questions to us via email at events@brookings.edu. That's events@brookings.edu. And we are very proud, as always, as ever, to co-sponsor today's event with Tsinghua University, which has been our institutional partner for 15 treasured years. In that time, we built a strong and enduring bridge between American and Chinese people. And that is emblematic in the collaborative spirit we see being fostered here today. So with that, I'd like to turn the session over to my friend and my partner and co-convener in this endeavor, Tsinghua University President Zhou Yung, who will share his introductory remarks. Ladies and gentlemen, again, thank you for joining us today, and we hope to have a very productive session for the benefit of both our peoples and both our countries. Thank you. Mr. President, please.
Thank you. Thank you, President Allen. Ladies and gentlemen, good morning and good evening. I'm honored to host today's webinar with President Airline. On behalf of Tsinghua University, I'd like to extend my sincere thanks to our distinguished speakers and our global audience who join us today. 2020 marks a watershed in human history. The outbreak of COVID-19 has been a major test for every one of us. As we enter 2021, the rapid development of several effective vaccines against COVID-19 offers the promise of a durable solution to the global pandemic. At this critical moment, Tsinghua University and the Brookings Institution co-host this webinar on fast track to recovery, US-China collaboration on COVID-19 prevention and treatment, as a wish to bring together policymakers and leading medical experts from both countries to form concrete policy recommendations, as well as to facilitate cooperation on medical research, vaccine development and distribution, and international protocol for travel and trade. Tsinghua University and the Brookings Institution have 15 years of profound and fruitful collaboration. Since October 2006, we have established the Brookings Tsinghua Center, which is dedicated to producing high-quality research and facilitating idea exchanges and crucial public policy issues among leading scholars and policymakers between China and the United States. I'm honored to have served as co-chair of the Brookings China Council since its establishment in September 2015. Now, our collaborations have smoothly extended onto a new stage. I strongly believe in the future. The cooperation between Tsinghua University and the Brookings Institution will continue to serve as a vital platform to foster mutual understanding and collaboration between our two countries. In the face of the pandemic, Tsinghua University has put the safety and health of our faculty, students, and staff in the first place. Last year, we started the spring semester online and delivered hybrid learning in the fall semester, integrating online and offline teaching and learning simultaneously. In addition, we swiftly initiated COVID-19 research projects based on Tsinghua's traditional strengths in science and technology, and have achieved substantial progress in medical and vaccine research, fast testing kits, and intelligent epidemic prevention systems and equipment. On March 2nd, 2020, President Xi Jinping visited Tsinghua to inspect the School of Medicine's research projects on COVID-19. 1 month later, Tsinghua established the One-Core School of Public Health. Dr. Margaret Chen, former Director General of the WHO, was appointed the school's inaugural dean. Tsinghua has also set up a research fund to encourage and support joint research projects on COVID-19 with global partners. Within 9 months, 12 projects have been successfully launched with 9 universities and institutions from 8 different countries and regions. Collaboration is of critical importance in an increasingly networked global community. As we enter the period of vaccine distribution, it's vital that we work together to develop and form concrete policy recommendations for the next stage. We look forward to working together with the Brookings Institution and our global community to facilitate a faster recovery from the pandemic through academic exchanges and research collaborations. I thank all participants for your contributions to to this event and hope for lasting outcomes from the content explored today. Thank you very much. Now, I'd like to invite Professor Xue Lang to moderate the keynote conversation.
The successful development of vaccines and the beginning of the wide distribution and use in many countries. However, the virus itself has not stopped its rapid spread. In the last few weeks, we've seen new variants spawning around the world. There's an urgent need for the global community, particularly the world's two largest economies, the US and China, to join force to stop the pandemic. With addressing COVID-19 a top priority for leaders in both Washington and Beijing, it is a critical time for collaboration. What are the ways the two countries can work together in medical research and collaboration? How can the two countries work with international organizations, such as WHO or COVAX, to facilitate fast vaccine development and fair distribution? What can be done to develop international protocols for global travel and trade? To address these issues, we're joined by three leading experts from both China and the US. Professor Zhong Nanshan, a member of the Chinese Academy of Engineering and the head of expert group of the National Health Commission of China. Professor Ian Lipkin, director of the Center for Infection and Immunity, Mailman School of Public Health, Columbia University, and Dr. George Gao, the director of Chinese CDC and a member of Chinese Academy of Science. Now, without further ado, let me first invite Professor Zhong Nanshan to make his remarks. Professor Zhong.
Okay, thank you, Dr. Xue. And then Mr. John Allen, and Mr. Chu Yong. So many thanks for inviting me for this joint meeting with Brookings Institute and the Tsinghua University. So that's a very interesting topic of this meeting. So can I have my slides, please? Yeah. Sorry. Oh, okay. This is my topic. I think that's the subject of the of this meeting: the fast track of recovering U.S.-China collaboration in combating COVID-19 pandemic. So, of course, this is yeah. Before I talk in that, I would like to talk a small story with Ian Lipkin. So that's the picture taken one year before, just before I depart from from Guangzhou. We met together in the 6 o'clock, and in the airport we discussed together and see how to deal with the COVID-19 before I went to Beijing. So, and look the picture here. So it's a very memorial picture. And also I remember another picture was taken, that was 2003, 18 years ago. So that's Ian. So look handsome and young. And then I think we have been knowing from each other for such a long time, and I really appreciate our friendship and so on. So now you look today, you look good. It's nice to hear from you. So I think everybody knows that's yesterday's data. So 113 million confirmed cases and 2.5 million deaths. That's a big problem now here. But as a chest physician, I should say the most memorable pandemics in human history. Of course, the majority are caused by the respiratory pathogen infection. That's transmission via the respiratory tract, plague, smallpox, flu, and this century, SARS, MERS, and COVID-19, of course. So that's a big problem in SARS. So we probably know the host and know the reservoir. And then the outbreak of MERS in Middle East, the host, yes, and the bat, and also the reservoir, camel. However, so COVID-19, now we still don't know what's the host, perhaps bats as well, but we don't know which one is the immediate reservoir. That's really important. I suppose the Dr. Lipkin will can find out, and then during our collaboration, we probably can find out what's the reservoir, which is extremely important. If we can stop this transmission road, that will be okay for the next pandemic. As you know, see the COVID-19 caused a big impact of GDP growth, and this is the GDP. This is China and other countries like in the United States. That's a big drop during the year 2020. So that's the impact of the economy, and also the passenger. So the airline industry, you can see a big drop here. So during the 2020, the passenger total dropped to 60% of COVID. So in the international flight, and the domestic, so 50% drop. And also, I should say, that's the percentage of the country reporting at least partial disruption in at least 75% of the medical care service. You can see here. So this is global. So 1/4 so disruption, and in particular in the low-income countries and the lower mid-income countries and so on. So more or less, that's a big impact of the medical service of that. And this is you can see, this is the so-called non-communicable services. And like we know, rehabilitation, hypertension, diabetes, asthma, palliative treatment, urgent dental care, cancer treatment, cardiovascular, all the drop, and then or disrupt, and then close to 50%. So what China had done, we just mentioned very briefly about that. That's the data. So we have the so-called 6-member national high-class expert committee. So George is there. So here. And then that's the day of 20th of January. So we announced the definite human-to-human transmission in this during this outbreak of COVID-19, and also confirmed medical staff have been infected since then. So I think how to go, the strategy. So just in front of the China government. So there are two ways. One is mitigation, and another way is suppression. The mitigation, of course, the general measures, but because of the very high reproductive ratio, the general mitigation may lost control, and also based on the very painful experience. So 18 years ago about SARS outbreak in China. So there's some idea in the central government. That's a very important point, is so-called life supremacy. That's a basic line, basic idea for the central government. So they choose the suppression by this way. So and after that, so that some action been taken. So of course everybody knows the lockdown Wuhan, and also inside Wuhan, the 16 makeshift hospital established to separate the patient from healthy persons. A very important issue is the so-called interagency mechanism. It launched so-called early protection and early diagnosis, early isolation, early treatment. this action is down to the all community level. That's very important step for China, the whole country. So what happens then? So you can see that first state is so-called blocking action. So it only took about not more 1.5 months to reach the peak, and then going down, drop down to the formal situation, and then keep the very low incidence, probably about 9 months, 10 months, and then the cumulative patients going to a plateau, similar plateau. And during this the last few months, there are some rural sporadic. So that's a little bit increase. So we have catch this time. So 10 months, so can reopen the economy and so on. That's why in China, so you can see the red lines in China, GDP growth. So this, of course, in the second quarter is going down and then going up. So yesterday, the central government had announced GDP increased by 2.3%. Seems to be okay by this the step. And also some others, like the financial safe rate on export business. So the export is like this blue lines in China. So you can see having a drop. So in the first and second quarter, and then going up, and then this so higher than zero. So the positive improve. So that's the main problem. And then I think that China had been met another questions. So we cannot have a very strict containment for a long time in order to recover our economy and reopen all the schools and all the social activities and so on. So of course, everybody knows now to set up and herd immunity. It cannot use that kind of things like natural infection. I'm not going to talk too much about that. So natural immunity and realistic, less scientific, and inhumanity. So massive vaccine is been noticed by the people all over the world. It actually needs 2 or 3 years time to have to set up this herd immunity. Of course, maybe longer. But now in China, so we have got 6 altogether, close to 60 trials, 60 topics of a different kind of vaccine being developed at the moment. But the 6 of them enter the phase 3 clinical trial. And here, so 4 of them, so Sinopharm and Sinovac and Casino, so now had been approved to have conditional marketing. So ABCD, this 4. Another one is actually developed by one of the person is George Gao, and then so had been approved for emergency use. That's good for that. So actually, I had developed that. But we can look at this number of the dose administered. That's data from February. So from 27th February, of course, in the United States, is the most doses being given. So that's in China. So not that many. But that's the absolute dose. But very important is we should see the vaccination dose administered per 100 people. So what's the percentage of that? So Israel is the highest. So 90%, over 90%. And the second is the United Arab Emirates, that's more than 60%. United Kingdom is also very good, and now it's increasing fastly. And then the US, the United States, so 22%. That's a data getting from a couple of days ago. and China's only 3.56%. So, and today, I asked my CDC friends and see what's the plan of the next few months in China, and they reply that planning to reach 40% at the end of June. I said that would be okay, but still need time to reach the so-called herd immunity. So this big problem is we have discovered a lot of multiple SARS-CoV-19 mutation globally. So you can see in Nigeria, UK, in the USA, and then South Africa, Brazil, and so on, and got a lot of mutation. So that is a big problem. That's a paper just coming from New England Journal of Medicine. And here you can see using a mRNA vaccine, the effectiveness of the neutralization is a much more drop, quite a lot. So as compared with the former one. So that's one problem. And the second problem is the so-called, as you know, the monoclonal antibodies are the best way to treat patients with COVID-19. So actually, there are some mutation in the UK, in the United States, and in Brazil. So both in the N-terminal domain and receptor binding domain, the red dot is a mutation, and the gray dot is a deletion. So that's because this change, so the monoclonal antibody, the effective will be less. So the big problem is mutate COVID-19 virus will decrease the effectiveness of vaccination and also decrease the effectiveness of antibody treatment, which is the most effective treatment so far. So the modify, improve the vaccines and cocktail antibodies is really emergent for next wave of pandemic in the near future that really need to have collaboration between the two countries, the two biggest countries in the world, United States and China. So actually we have already had some collaboration from our part, Guangzhou Institute of Respiratory Disease Health and the Harvard Medical School. That's the day of February, so last year. So we have already had 1 year collaboration. It seems to be very fruitful during the recent meeting. And in terms of the faster diagnostic technique and so-called the vaccine development and so on. So this is why we need to have closer collaboration from each other, so to face our common enemy. So thank you very much.
Thank you very much, Dr. Zhong. And I think that was a fascinating discussion on the issue, and hopefully we'll have more time for discussion. Now let me invite Professor Ian Lipkin to make his remarks. Professor Lipkin.
Thank you. First, before we get started, it's so good to see Gao Fu, George, and Nanshen, and Tom Frieden, all friends of long standing. I've worked in China since 2003. I'm not going to be showing any data slides today. I'm going to focus instead on my personal views in terms of the history of pandemics and the future of pandemic prevention. My mother, who died 6 years ago today, at the age of 94, was born in New York Harbor on a boat that was in quarantine because of a typhoid epidemic. So I've been involved in this work for 100 years, even before I was born. Those of us who are over the age of 60 will probably remember polio. It was brought to heel by vaccines. What many people may not appreciate is that this was an international effort. In the US alone, there were 2 immigrants and the child of a recent immigrant who developed that vaccine. The smallpox eradication campaign was, again, a global effort between the West and the East. There was a Soviet scientist who was responsible for developing the needle without which the vaccine program would not have been successful. I remember when I was training in the 1980s in San Francisco, the emergence of HIV/AIDS. We didn't know what it was. And squabbling for 2 years between 2 groups, one in the US and one in France, delayed diagnostics and medical interventions that could have saved hundreds of thousands of lives. And in the late 1990s, although we should have known about emerging zoonotic agents, we hadn't really focused on them at that point. The emergence of West Nile virus in North America was a transformative event and led us to this whole field of One Health. In 2003, I was invited by then Vice President of CAS Chenzhou and Minister of Science and Technology Xu Guanghua to work with the Chinese government in addressing the challenges of SARS. And I can tell you that in the time since 2003 and the present, the technology, the infrastructure of the CDC, universities and such has dramatically changed, and to the point where it's, unparalleled worldwide. I worked with Ziad Memish and KSA during the early days of MERS in 2012, and with Soumya Swaminathan, who's now at WHO, but who was then the director of the Indian Council for Medical Research on unexplained encephalitis in Gorakhpur. And finally, as directing biodefense research laboratories after 9/11 and working under Tom Frieden with something called the National Biosecurity Advisory Board, and more recently, the advisory committee, the director of NIH, Francis Collins, I've seen the importance of global collaboration. And many of you will know about the film Contagion and some of the public service announcements we've tried to engage in to educate people in the US and abroad. Over the past 35 years, what I've become convinced about is that the largest obstacles to progress are not technical or scientific. As you've seen, our ability to make vaccines and diagnostics is extraordinary. It's international, interinstitutional, and interpersonal trust, respect, and collaboration. And this is why this conference is so important. SARS-CoV-2 is unlikely to be the last challenge that we face as a species. We underestimate a wide range of viruses, bacteria, antibiotic resistance elements, and fungi. These pose threats not only to human health, but also to climate and to food security. One of the challenges in public health is that when we are successful, everybody forgets about us. Nobody pays attention because there is no problem. So when COVID-19 is in the rearview mirror, it will be very, very important that we keep up this emphasis on what I call the 3 pillars of success in preventing pandemics. These are intelligence, insight, and implementation. Let me tell you what I mean by that. So intelligence is surveillance. It has to be global. We have to have data integration and data sharing. We are better at this, but we have problems still. And some of the preprint servers that people use to post data are publishing things that are not true and mislead individuals and waste resources. And we could talk about drugs that were promoted by our last president that are a challenge. Insights, basic and translational research. Again, I've seen in the US investments that have waxed and waned in support of basic science research. This needs to be sustained. And finally, implementation, the testing and the rational distribution of diagnostics, drugs, and vaccines that mitigate disease. We need a global Food and Drug Administration. Sometimes there's an outbreak in one part of the world that moves to another. It makes no sense to have multiple FDAs so that everybody has to go through the same process over and over again. We need to work together in a global fashion. About 2 years ago, I began working with colleagues in the intramural program at the National Institutes of Health, the US CDC, my colleagues at Sun Yat-sen University, Professor Liu, as well as public health practitioners in science elsewhere in China, including George, Mali, Liberia, Indonesia, Mexico, Pakistan, Saudi Arabia, Israel, Brazil, the DRC, and India. And we got some funding from the Skoll Foundation to build a program that is designed to complement WHO, not to replace it, not to replace the CDC, but to go places where other people cannot go, and to do what Gavi does, which basically is to provide infrastructure so that people can do surveillance and they can set up clinical trials. Our first efforts in surveillance and treatment trials are at Fiocruz in Brazil, where we've been testing convalescent plasma. We're also promoting sequencing at the University of Bamako in Mali and the Indonesian Research Partnership on Infectious Diseases in Jakarta. And if you're interested in learning more about these efforts, please be in touch with me, either through the organizers or through the Mailman School of Public Health. And with that, I think I'll close and move over to George.
Thank you very much, Professor Lipkin. Thanks very much for your insights and also your very interesting proposal to have a global FDA. Now let me invite Dr. George Gao to make his remarks. Dr. Gao.
Good evening. Good morning, everybody, especially my friend Ian and Tom. I saw a lot of friends there. I think today our topic would be focusing on the fast track to recovery, especially addressing for the collaboration US-China for the prevention and control of the COVID-19. Let me start with the challenge and the chance for this collaboration. So I keep telling people we have to follow the 4C for the Sino-US relations. We need a collaboration. Of course, we also need a friendly competition. Without the competition, I don't think we can promote the society, the economy. So that must be the friendly competition. And to do the collaboration competition, we need communication like this, Brookings and Tsinghua University. I'm very pleased to be here to chat with everybody to discuss how we can collaborate, how we can friendly compete to promote the science, to get the disease under control. Of course, we also need the coordination. So these are 4C principles. So this overview, while we are talking about the COVID-19, everybody should note, we also have the Ebola. The Ebola is here in DRC. So we are facing COVID-19. Meanwhile, the Ebola still here. And think about what we have done for the antiviruses without vaccines. So NPI, non-pharmaceutical intervention, is very important. China, by using the NPIs, we did a good job for the last year. You know, from the lockdown in Wuhan to the suppression of the whole country. And now, in my opinion, we might be like Dr. Zhong said, we are approaching to a process of strategy mitigation. Of course, we need the vaccines. More importantly, we also need the antivirals. We need the collaboration. We need the competition to develop small molecules, monoclonal antibodies, or antibiologicals for antivirals. Give you an example. Here we go. For the whole world, when you're talking about the vaccines, because the virus was first discovered in China, we had a live virus. So we put forward for vaccine with the inactivated vaccine. We need global virus and then inactivate them, and then we develop inactivated vaccines. For those, including the US, because you don't have the virus from the very beginning, very quickly we share the data, you have the sequence. This is the 21st century technique. So many vaccines under development. Here you go, Moderna, BioNTech, and Oxford is adenovirus based, and also for the mRNA-based vaccines. Of course, you could substitute for Sputnik in Russia. And think about in China, as I said, we have 3 of the inactivated vaccines already after CMA. See, we also have another one for the protein subunit vaccine. It's a EUA soon. So we have 5 in China. I think in this stage, in the world, in the US, in China, we are developing the vaccine based on the conditions we have. And so this is where we are at the moment. More importantly, for the public health emergency, we need 3 steps, science-based. So this is why China, US, we need to share the science part. And more importantly, we need public understanding, environment, and compliance. Also, we need authority, informed authority decision-making. That's very important to look at. In my opinion, those 3 steps we used for US, China, the rest of the world. But in the different countries, we use a different, by introduce a different strategies in a different times. So in China, we call it 3 bigs. I think in US, you called 3 Ws, wearing, watching, and washing. So I remembered when in the end of March, I was interviewed by the Science Journal. So I called for the mask wearing, but even by then, we still have problems for the world. And the public compartment is totally different from country to country. So this is, we have to learn, we learn a lesson, we should move on. So now, Ian also mentioned, we collaborate with Ian and so many scientists together for the virus investigation and for the animal origin of any kind of virus, including the bats. But we, this time, we rely on more of the common sense and knowledge. We thought there might be a reservoir host by 1 year hardworking. We haven't found any, reservoir host, and also no find any intermediate host. So this is why I think we are coming to the science. For the origin of the virus, now it's the science part. For that, China and US, we need to work together. We need to pick up the so-called global viral project to work together by science. What we have done, Dr. Zheng Nansan also mentioned to you. In my opinion, China, we already go through 3 strategies. I propose for the last one, we haven't done that yet, lockdown or elimination. That's in Wuhan and a lot of big cities. And suppression, whenever you have an outbreak, local transmission, we just try to suppress it. Now we need to keep the society socially active, economically strong. We need mitigation, i.e., we want to leave some small local outbreak there and keep the society and the economy active. So this is my opinion, but let's wait what we can do. Lastly, I'm calling here. So the COVAX is very important. United States and China, we should work together to promote the COVAX. We should also work together for the United Nations 17 SDG. I'm sorry, I still missed that S. And also equity, and very important, in China, we call it that we are in a state inadequate and imbalanced development. It's a key problem in China at the moment. We just had our meeting recently. I think Dr. Xue is there. So we need to work together to keep the equity for the vaccine, equity, and try to solve the problem for the poverty. Poverty, equity are the common disease or the common enemy for both US, China, and the whole world. Let's work together. I'll stop here. Thank you.
Thank you so much, George. I think this is our, you 3 have made wonderful remarks, and now we have about 10 to 15 minutes to the discussion time. I think, we would like to have more questions, but of course, I think we try to, if possible, you can make your answers try to be brief. Let me start with a question that is probably lingering in many people's mind, and you are, of course, you probably are all tired of answering, but still, I want to ask this question. How are we doing in controlling COVID-19? And particularly, when can we return to normal economic and social life? We know it's not the past normal, but it's going to be new normal. But when?
I think that's a very good point. I think everybody might have a different opinions. I think Ian and Dr. Zheng Nansan might give a different answer. But it doesn't matter because a new virus, no one knows what's going on. But what we see after the 3 Bs or 3 Ws in the US and Europe, especially lockdown in the European major cities, and of course, very clean in China, I think we have a very sharp decline of the COVID-19 in the whole world at the moment. So in this case, in my opinion, a lot of factors there. At least most important thing is the key point is the key population were vaccinated. In the US, someone working in the hospitals, nurses, doctors, and also working in the public health sectors, they were vaccinated. I call those people are key population. So this is the first time for the whole world. Whenever you see the key population were vaccinated, you might get there for the business. Of course, maybe people would say, well, that's not a major factor. In my opinion, that's a major factor. And also another factor is the virus might be either declined pathogenicity. So a lot of factors there. Now, when we can get into normal, in my opinion, we will never get a so-called normal as before, but we will get approximate normal maybe by the summer of next year. Thank you.
Okay.
And
Maybe, yeah, Dr. Zhong.
Yes, I would have thought, I mean, I agree with George, what George mentioned about that. I think now the key point in the world is receiving vaccine as soon as possible. So the longer you receive vaccine, the more variant, the more mutation of the virus. So that's a big problem. So I think this would speed up the production and all the vaccine, and also prepare some new type of vaccine, which is sensitive to variant virus. So this is very important for us to cooperate from each other. So because the containment cannot be lasting too long, because we really need to reopen, to return to normal life. But as far as I understand, so perhaps whether the COVID-19 will become like a flu. So every year or every other years will happen. So nobody knows whether they were like the flu. So also possible. So once we get the vaccine and then have some shift of the coronavirus, we need to have some new strange of antigen to make some vaccine. That will be okay, because up to now, I think there's some in our study showing that some antibodies of SARS antibodies still exist in about 3 to 5% of the patient in the blood bank. So that's they exist, although it happened 18 years ago. So actually, still exist from time to time, but it doesn't cause some outbreak or some other things. So that's what I think. So you can never eradicate COVID-19. In particular, this kind of coronavirus. It actually happened 3 times in this century. So I should think maybe. But the big problem is I would like to ask Ian. So you have mentioned about the screen or survey surveillance. I'm in particular interested on that. So although we don't know the host, but we really need to know the reservoir, the intermediate animal. What is that? So because as far as my experience is concerned, so the 18 years ago, we had found civet cat is one of the key animals. Oh, okay, when we stop this transmission road, it's okay. I don't know whether it's by chance, but I do believe, because based on several studies, it shows it is the case. So whether I really want to know whether you have develop some technique, and then have some cooperation in terms of the surveillance of various animals and all the things, and by using the technique or something like that. Thank you.
Thank you. Professor Lipkin, do you have any comment?
Thank you. So first, the question was about the future.
Yes.
Like the physicist Niels Bohr said, it's very difficult to make predictions, particularly about the future. And I think that's true here. And you've heard that from George and from Nanshan. But I think that there are different ways of looking at it. Mm-hmm. Until the entire world is vaccinated, the situation is bleak. And that's why George was referring to COVAX and the importance of investment in the developing world as well. Even after this pandemic recedes, there will be people who will be ill as a result of having had COVID. And I will tell you that as someone who had it, I'm still not back to 100%. So there are many people who will have residual effects that will be important as we move forward. In terms of what is likely to happen with this virus, my experience with coronaviruses is that they are very difficult to eradicate. And I would predict that this is going to continue to be with us for a very, very long time to come. But like flu, we're going to see less and less severe disease. And as long as we keep up with this with respect to vaccines, as Professor Zhongnan Shen said, every other year perhaps, I think we will be in good shape. Now I'm going to come back to one of the points that I made earlier about international collaboration. I have a program at Sun Yat-sen University with Professor Liu, focused on zoonotic diseases. About 2 months ago, using a commercial ELISA kit, we began looking for antibodies in people exposed to wild animals and butcheries in places like this. And we had some signal that was very interesting. When I went to then send microarrays that could be used to differentiate between different coronaviruses, including SARS-CoV-1, I ran into a problem of an export license. You could not export these peptide arrays to China. So the whole project came to a stop. So again, with this new administration in place, I'm confident that we're going to be better positioned to work together as we have in the past. Thank you.
Yeah. Okay. Thanks so much. I think given the time limit, I think we probably have just time for one final question. I think very proper with very brief answers. Let me, ask you guys that if you were to meet with, the leaders of the two countries, what would be your sort of, the one single most important proposal you would make to the leaders? Anybody can.
George?
George, okay.
Maybe,
I think that's a quite a difficult question, but to my mind, I think maybe all the police decision maker or the policy maker, so all the policy working out should base on science and evidence rather than politicization. So that's one key point for me. So once we can base on that on the science, we can go to the common road, the same road, and to cooperate from each other. That's what I think in my mind.
Yeah, excellent. That's a great point.
so,
George and yeah.
Yeah, my suggestion to the leaders, because at the moment, US and China, we have some difficulties in a lot of areas. Just leave the divergence. Try to find the easy project, easy way to collaborate. For example, public health, vaccine. Thank you.
Great. Okay, Professor Lipkin?
I think they've covered it beautifully.
Okay, wonderful. Thank you so much. You three are just wonderful panel. Thank you so much for this wonderful panel. Now let me turn the floor Now to my dear colleague, Professor Cheng Li.
Well, thank you, Dean Xuelan, and thank you to all participants in our keynote conversation for an historically illuminating and forward-looking discussion. Now, I'm pleased to introduce our second panel of 4 distinguished medical doctors, which I anticipate will be just as enlightening as the first. The goal of this expert panel is to present concrete ideas for greater bilateral and international collaboration to fight and stop the spread of COVID-19 in 3 key areas, namely medical and research cooperation, vaccine development and distribution, and international protocol for global travel and trade. We are joined by 2 panelists from each country, each of whom will offer 5 minutes introductory remarks. Because we are behind the schedule, please make sure 5 minutes, which will be followed by a discussion and a Q&A. We have a really large number of the question from audience. Now, on the US side, we are honored to host 2 distinguished public servants, former CDC Director Tom Frieden and the former FDA Commissioner Jan Henning. Dr. Frieden currently serves as President and CEO of Resolve to Save Lives, working with the countries to prevent 100 million deaths, especially those resulting from epidemics. He is also Senior Fellow for Global Health at the Council on Foreign Relations. Dr. Henning, who was the first woman to serve as FDA Commissioner and an oncologist by training, is a member of both the National Academy of Medicine and the National Academy of Sciences. She has served on many cooperative and nonprofit boards in the past, including the China Medical Board. On the Chinese side, I'm equally honored to introduce Dr. Wu Zhenyou and Dr. Zhang Wenhong. Dr. Wu served as Chief Medical Officer and the Director of the Division of Health Education and the Prevention of China CDC. Having been involved in HIV/AIDS research, the SARS response, and other public health programs for over 30 years, Dr. Wu has worked to control the COVID-19 pandemic, including as a member of the WHO China Joint Mission soon after the break of the beginning of 2020. Dr. Zhang Wenhong, a household name doctor in China, is the Director of Development of Infectious Disease at Huashan Hospital. Dr. Zhang has served as the head of Shanghai's anti-COVID-19 clinical expert team of 60 medical specialists. He has been recognized for his role in candidly and frequently disseminating useful information and scientific knowledge. Now, with that, I would like to first turn to our American colleagues, Dr. Frieden and Dr. Henning, for their opening remarks. Dr. Frieden, the floor is yours.
Thank you very much, and it's a great honor to be with this group. Thank you for the organization of this and for the wonderful remarks that we've heard so far. I'll go very quickly through some slides which may help us stay on the same page. I think collaboration is so important. As has been said already, we know that vaccines are safe and effective and hold the prospect for an eventual end to the pandemic, but that rollout has been slow and demand will outstrip supply for months and, unless there is more manufacturing, for years. We need to address inequities, both health and economic, in the vaccine program. And we have to be very open about the things we don't know. We don't know how long immunity will last. We don't know whether there are rare adverse effects. So far, very, very few. We don't know how and whether we will accelerate manufacturing, and we don't know whether people will trust the vaccine. Global collaboration and cooperation is essential. We've talked about a 717 goal, surveillance, real-time surveillance to detect every outbreak within 7 days of its emergence. Response, so there is investigation and reporting within 1 day, 24 hours, and establishing an entire effective response capacity within 7 days. That 717 approach in every country in the world would make the world much safer. And perhaps it's something that the US and China can collaborate on to strengthen systems around the world. Laboratory, we need national laboratory systems, not just the high-level laboratories, but every step of the laboratory network. And we need a workforce of highly trained, experienced staff able to analyze emerging threats and implement control solutions. Resolve to Save Lives is honored to be registered in China, in Shandong province. Globally, we work, as mentioned, on cardiovascular disease and also on epidemic preparedness. Over the past year, we've pivoted to be working on COVID as well as epidemic prevention, primarily in Africa, on health workers' safety, where not only training, but we must do much better keeping health workers in every country in the world safe. And on cardiovascular health, where we have advocated with the World Health Organization for the global elimination of artificial trans fat, which is a toxic chemical in our food supply, and supported partners to reduce sodium consumption, which kills millions of people a year, and improve hypertension control, something for which good primary care will be essential. Sodium reduction is something that is often overlooked and neglected, but actually it can save millions of lives, and in fact can be done with government policy as well as community engagement. I would say that primary care is the most needed and most neglected aspect of our health care system. And to improve hypertension treatment will both require and facilitate the establishment of effective primary care. We talk about universal health coverage, but unfortunately, in most countries of the world, including the US, this is a slogan because we don't have good primary care systems. And because of this, we aren't well situated to find diseases fast, prevent them, and treat them effectively. We really believe that controlling high blood pressure should be a key priority for global action. It kills more people than all infectious diseases combined, 10 million people every year, and yet it's easily treatable with inexpensive, safe medications. But that requires using a simple protocol, quality-assured drugs, team-based care, patient-centered services so that the patient has no barriers, neither cost, nor travel, nor pay, nor attitudes, and a systematic, accurate, real-time monitoring so that programs can see and improve their quality. I think we must strengthen primary care. This is perhaps a key lesson from the COVID pandemic. We know that non-communicable diseases such as hypertension, which I was very pleased to hear discussed earlier, will continue to be the leading global causes of death. They also cause disability and decreased productivity. In addition to saving lives today, stronger public health and primary care will increase productivity, prolong disability-free life, and promote community and individual resilience against COVID and future health threats. Final slide. Health threats can either unite or divide the world. The choice is ours. In the past, as has been mentioned, health has been a bridge for peace, whether it's smallpox eradication, childhood vaccination, lead gasoline elimination, or more. And vaccine nationalism will backfire. Only global collaboration against the virus can lead to global recovery. Global commitment is crucially important and can save millions of lives and literally trillions of dollars. I believe it is now or never. This is the world's moment to work together, and the US and China have a unique role to play so that never again, as my friend Tony Fauci said, never again will we be as unprepared as a world for something as catastrophic as what we're going through now. Thank you very much.
Thank you, Dr. Frieden. Congratulations for your really impressive work on the front line. And also, I'm particularly enlightened by you talk about the public health in general to improvement around the world. Thank you. Now, Dr. Henning, yours.
Thank you very much. And I too am just delighted and feel very privileged to be part of this group and this very important discussion that we're having this morning. I think as I present, I'm going to be primarily focused on the FDA and in the US and how it works. But being a part and leading a regulatory agency such as the FDA was an extraordinary experience in my career because it really brings four major elements to bear that are so important, I believe. First, it's grounded in the law as it relates to those matters that are important to the public. From that emanates regulation and policy. And then it uses science both to be its bedrock of decision-making And certainly protecting and promoting the public health, that fourth function is really the agency's North Star. And I think it's such a privilege and to be able to pull on all of those elements as one thinks about COVID and how FDA has played a role in that. The pandemic has been simply remarkable, and you all have spoken about its impact not only on both of our countries, but the world, and down to the individual impact that some of us have experienced. It was also remarkable, I think, to hear of the vaccines that have been approved in China so quickly, and certainly the 3 vaccines being approved here in the United States within a year of really our learning about this virus is remarkable, to say the least. And 2 of these were based on the new RNA technology but that new technology, I think we have to all acknowledge, was built on literally a decade or more experience in our basic science labs, both at NIH and universities around the world. So we can't think that we just woke up and invented all of this in a year. It really takes that investment of basic sciences at all of our institutions to have at their ready knowledge and experience to bring some of these things to the fore. Each of the vaccines that the US has approved, they've done it under the Emergency EUA Act that has a different evidentiary standard in the US than those biologics that come through the normal, what I would say the normal BLA process that has to have a full safety and effectiveness evaluation. The EUA evidentiary standard is different in that it has to have, it offers temporary approval until a full approval of all data can subsequently be submitted. But the standard is that it's reasonable to believe that it may be effective. And in this situation, the guidance that FDA gave was that its effectiveness needed to be at the 50% level, which is the same as is influenza. Happily, each of these 3 were much more efficacious than this. Now, effectiveness will be a totally different matter. Effectiveness is measured by, do you get the vaccine in people's arms? And do you have an effective program? I also would point out that the process within the United States is different than in other nations or other countries. Each uses their own process of evaluation. In the US, the scientists who work at the FDA receive all data from the companies, do independent analysis on that data, and then that is all presented to an open a committee that is, and this was remarkable this year, all made available on different webcasts, so people could actually see what the committee was evaluating. And that advisory committee is made up of individuals from multiple scientific disciplines. It has people from industry on it. It has people from different aspects of government, as well as on occasion patients. So a wide array of people to advise and hear what FDA is recommending, to hear from the particular industry their own presentation, to hear the concerns of people that might want to question or have different points to raise to the committee. The committee then makes recommendations to the agency as whether an EUA ought to be granted. And then the agency takes that all into consideration and gives its approval or not. In these three cases, approval was reached that is then transmitted to our own CDC. Tom Frieden knows this process well. It happens every year with the flu, and then CDC, working with other agencies, makes a recommendation that in this case, the vaccines can be used in programs. We've most recently seen that approval given to the J&J product, which is the one-shot product. And now the vaccine can be dispensed more widely. I think it is interesting to note that there are challenges both in the distribution of this product across the country. The Pfizer product requires ultra freezing conditions, which aren't available in most doctors' offices or sometimes even hospitals. So that has been a challenge. Both the Moderna product and the Pfizer product require 2 shots. That doesn't sound so difficult, except just the practical considerations that if a person gets a reaction on the first time, they may not want to desire or come back for that second shot, which would be important. And then I think those 2 elements are a bit of the challenge in terms of distribution. The J&J product may not be as efficacious. The efficacy data wasn't as strong. However, it should be noted that no patient in those clinical trials who were in the treated group required hospitalization. So one might get a milder form of COVID, but the advantage of having a one-shot program now available is terrific. Manufacturing is going to be an issue, but it's interesting to note, at least to date, that there are a lot of companies that typically compete head-to-head, toe-to-toe with one another, are offering their facilities for manufacturing, offering their facilities for overfill of the different vials. This is an ongoing process, and I will just close with this, that this whole COVID experience is something that we have to make decisions, important decisions based on what we know, but we have to keep learning from research that comes along so that we can make this an even more effective program. And I'll stop there.
Dr. Henning, thank you so much. And early speakers talk about importance of vaccine and also the size of the vaccination. But it's assuring to hear from you as a former FDA administrator and talk about the process, that the U.S. went through. I think that's really very, very helpful. Now we turn to Chinese doctors. First, Dr. Wu Zhenyou.
It's a great honor to join this dialogue. Thanks the moderator for your introduction. So first I want to begin with the question Professor Xuelan asked. And also it is the most common question people ask. When can we get back to the time before the pandemic? If we look at global epidemic, the peak of pandemic already passed. So the epidemic started to decline since middle of January. Now each day still have about 300 to 400,000 cases reported globally. The future direction of epidemic move will depend on combination of 3 factors: public health measures taken by the country, by the community, the coverage of vaccination. The third factor is how long will the vaccine provide protection? So these 3 factors are very important to determine the future direction. At least we can, based on the science, to make a reasonable estimation for the short-term future of epidemic. It will be very difficult to make the prediction for long-term. It will be almost impossible to eliminate the epidemic in short time. So my second remark also related to the question Professor Shenan asked. If participants today have opportunity to meet the top leaders in the 2 countries, what can we do? So I propose, can we promote as US-China as top priority for free travel in the 2 countries? China now is the safest country in the world in the terms of COVID-19. In the community, there is no single cases in the community. So no people carry the virus. They travel to anywhere, cannot bring the virus to. In the United States, look at the vaccination rate. Now it's already reached over 20%. Hopefully it can reach over 80% by June. So by August, it could be reached 90% to reach the herd immunity. So if that's the case, if we could remove all the political barrier, just based on the science, 2 countries could possibly to, as the first 2 countries, to move all the barrier for free travel. So we can try our best, no matter what's the result, we could do our best. So that's my remarks. Thank you.
Great, thank you. And you are more spontaneous with the Dr. Shelan's question. It's very, very helpful. I probably will have a follow-up question later on. Now it's Dr. Zhang Wenhong, your turn. Dr. Zhang? Dr. Zhang? Dr. Zhang Wenhong, we cannot hear you. Yeah. For some reason, we cannot hear you. While we're waiting, probably let me ask a question for the previous speakers. We try to figure out, Dr. Zhang. Okay, this is a question for Wu Zhengyu. Talk about the collaboration, talk about the both countries. Now also, this is also for two American. As we know, the transparency and the data sharing remain in very, very imperative to fighting emerging variants and also determining the efficacy and the safety of vaccine candidates. So my question is, what can we do? We will go back to data. What can we do? And the FDA, the Drug Administration, both countries, what can we do in this area for cooperation, data sharing, and etc.? Now, Zhang Wenhong, are you back? Are you back? Could you unmute? Not. Zhang Wenhong, could you speak? We're still having problems. Dr. Zhang, you can speak. That we will go back to that question later on. You need to unmute.
Yeah. Can you hear me?
Yes.
Can you hear me? Okay. Okay, I'm very glad to attend this meeting. So just like the speakers mentioned before, now it's a good time for the whole world that the global epidemics has begun to turn a corner. In the long run, epidemic control actually cannot be sustained through non-pharmaceutical interventions without global vaccinations. Even today, we know that China, we control the epidemics very well by the non-pharmaceutical interventions, and also United States control the epidemics very well. Also, they combine the non-pharmaceutical together with the vaccinations. So the development of the COVID-19 vaccine has created a record in the history of development of the new vaccine. Within 1 year, the whole process from the development of the vaccine, the marketing of the vaccine has been completed. So at the present, we know that the global vaccination, so the rate is very now today is very quickly in the United States and also in the United Kingdom. It's expected, like the Professor Tsinghua mentioned, that maybe at the mid, in the second quarter or the third quarter, they will arrive the level of the herd immunities. So at the present, in China, we have 7 COVID-19 vaccines have entered the phase 3 clinical trial in China, and 3 have been approved for conditional marketing. Although the current vaccination pace in China now today is very low due to the outbreak control in the early stages, and the vaccine capacity, however, is expected to very high and increase to 2.1 billion doses by the end of 2021. In December 2020, China proposed a 3-step strategy for vaccinating key groups, including the high-risk groups and other general populations. Given the timing of the global opening, subsequent vaccination in China and the rest of the world must be accelerated. So I think it's now today, the United States and Europe is very quickly for the vaccination strategies. So in terms of global vaccination today, by mid-February 2021, so in United States and United Kingdom, the immunity rate now is as much as almost 30%, and the United Kingdom higher than that. However, the global vaccination is currently very unbalanced in terms of the global vaccine supply capacity. Full vaccine coverage can only be achieved in the United States, Europe, and a few countries such as China and Russia that has vaccine production capacity by 2021. Historically, global epidemics have required global collaborations that transcends the politics. Just we mentioned that if we can meet the leaders of our 2 countries, what we will take the strategies. Because the vaccination does not happen overnight, the protection it provides does not last forever. Vaccination and the public health measures must be carried out in a tandem with the complete control of smallpox and the global prevention and the control of the influenza in the history. So today, the strict public health measures are very often in all the countries, but I think it's not sustainable. In this case, how to maximize the more normal life is a global challenge. The global challenges exist in the variety of vaccines, duration of efficacy, and the virus mutations. So the vaccination and the nucleic acid testing may be the main tools to help the world restart the near future. But it is still important to reach a consensus on strategies. So it's very difficult to make a consensus around the world. The scenario today we can expect is that the vaccination and the nucleic acid testing reports must be the passport of the world travel. With global vaccination, which offers long-term protection and no breakthrough caused by viral mutations, it is possible that the world will eventually be completely open. These scenarios are complex, and China and the United States the two countries that have the most contact and the close relationship should set an example for the world in terms of vaccination and mutual recognitions. So this is what I want to deliver the message. Thank you.
Thank you so much, Dr. Zhang. We only have 5 to 10 minutes left. So let me combine the audience questions, probably direct to each and every one of you for one question, but welcome comment. First of all, Dr. Wu Zhenyu, this is I just mentioned that the transparency and data sharing remain imperative for fighting against the coronavirus. So what China can do more in this area, particularly we deal with the variants, deal with the many other challenges. Now, the second one is for Tom Friedman. This is a question raised by Anu Anwar, a fellow at Harvard. She asked that how US-China collaboration in pandemic prevention will be helpful for the rest of the world, especially for developing countries. And also Reuters, a reporter asked that in your view, or anyone else, that when will likely the entire world, especially developing country, will have this kind of immunity, the herd immunity in your assessment. Now, the question for Dr. Haney is, do you see, this is on the treatment side, not vaccine, do you see that we will develop a kind of like a cocktail, this kind of treatment, like the HIV AIDS to treat the way to deal with the COVID-19 patients? And finally, for Zhang Wenhong, as we know that Dr. Zhong Nanshan earlier mentioned that China by the end of June will have 40% of the people have the vaccines. So the question is that now, first of all, that you said somewhere that China need to be concerned about the kind of immunity gap, because given that the population, Chinese population has not been exposed to the virus at a rate comparable to the other countries. So again, we earlier heard that it should be 70 or 80 and 90%. Now, and also there's a question about China's production capacity. Is that necessary for China to still import vaccines from foreign countries? Now, these are the questions. So who wants to go first? We probably can have 5 minutes extension. Yeah.
So let me respond to your question about the transparency of data information. Actually, China did the best, I think. It's miscommunication. The international does not believe that. If we look at the early epidemic, even we do not know the virus. So we share information with US CDC, with European CDC. Once we isolate the virus, and particularly the virus sequence, we upload to WHO, shared with the world. So that's the transparency. Also, if you look at the State Council as the press conference, that's almost every day. Every day they have a press conference to release the information about COVID-19 to the public. And when every outbreak occurred in China, is the first time reported in the media. So that's transparency. Also, in terms of vaccine, for the vaccine trial, so particularly for the phase 3, it's a public registered, all the information shared with the world. So I believe in China, we did our best to be transparency, to share all the information we have. Over. Thank you.
Dr. Wu, thank you for your certainly international medical community acknowledged China was very quickly to find the gene sequence of the virus and share with the international community. Now, Dr. Frieden, this question that I raised earlier, this is really about the multilateral initiative, how that link to the bilateral effort on China. Do you see this a tension, or this China, United States can complement each other to contribute to community, global community with the vaccine development and the distribution?
Thank you. Thank you for this opportunity, for this interchange, which is so important. And I think it's not either or, it is all of the above. We need to strengthen global institutions, including the World Health Organization, which is a critical anchor to our efforts. We also need to think about other global institutions which can play an important role, such as the Global Fund, which is good at financing health programs around the world. But also US and China can have important bilateral work, for example, to better understand the epidemiology of COVID, because there's still a lot we need to learn, whether it's about the variants or about asymptomatic spread. There is still a lot. It's just 1 year that we've been learning about this virus, and it still has a lot to teach us. And the more we collaborate, the quicker and the more completely and accurately we will learn. There's also a great value to our working together in other parts of the world, such as Africa, to strengthen early warning and rapid response systems. And I think also to think of how we can expand vaccination globally. And that's going to mean ramping up manufacturing. That may mean sharing intellectual property and technical sharing of technical information, so that manufacturers in other parts of the world can benefit from what is really should be a public good. We're all in this together. The only enemy here is a virus. And the more we are united, the more effectively we will be able to fight that virus. And to the Reuters question about herd immunity and vaccination, I think, as with so much with this pandemic, a lot depends on us and what we do. The more we collaborate, the more we scale up manufacturing, the sooner the world can get to a much safer place, because uncontrolled spread of this virus anywhere in the world is a threat everywhere in the world because of the emergence of more dangerous variants. So it's in all of our interests to work together and improve access, not just to vaccination, but also to effective control measures to reduce uncontrolled spread. So thank you very much. And again, it's been an honor to be part of this conversation.
Thank you. So well said. Dr. Haney, do you have any comment on treatment?
Well, I could make a comment on treatment, which I will, but I would like to come back to this whole notion of working together. Certainly, the FDA has, for many years, been working on this whole issue of harmonization of applications that come before it, so that when companies bring forward an application to a regulatory agency, they can essentially submit it around the world. That is the ideal. And then each regulatory agency, using its own statutory and evidentiary base, can make their decisions on that. That certainly would expedite things. It all starts with the MOU, or Memorandum of Understanding, between countries. And it certainly comes from a lot of communication and knowing the individuals on the other side of the table, be it China, be it the UK, be it our counterparts in Africa. And those help smooth the doors like anything, knowing who you're working with, knowing the constraints are under, knowing the facility of how different countries do things can make the whole process better. But I think as we think about COVID, it's so critically important that what we know needs to be depend on what's true. What can we track back to having a true scientific basis? And I see one of the most dangerous things that has come to the fore in this pandemic has been forces where we have tried to say what we know, and it's based on conjecture or kind of conspiracy theories. We need to define what we know based on the science of what we know at the time, realizing that we can always know more. And I think that comes in with what we're doing this morning, to try to learn from each other, to share information so that we can really combat what Tom has just said is the real enemy here, and that's the virus. But working together on this can only strengthen our relationship to working on a wider variety of things as well. I do think that getting back to the therapeutics where you wanted me to start, there have been a few that have been given emergency use approval by the agency. They have their challenges. Many of these so-called cocktails, if you will, have to be administered when somebody is in the more mild or moderate stages of the disease, and it has to be given in infusion centers and people are reluctant about bringing patients in-house to do those kind of things. And also people that administer them, working on these infusions, have to be specially trained. So like everything it has promise, they also have challenges. But I would say we're in early days here. Many companies are working on this. Many people at universities are working on new approaches. And I do think that there will be promise here at some point.
Well, thank you so much, and excellent point. And to look back the 40 years of U.S.-China collaboration to fight, epidemics. Actually, the COVID-19 has been an exception rather than the norm. So unfortunately, in terms of lack of government cooperation, but the good thing is the medical professions, they still work together, like the wonderful case that Zhong Nanshan and Yang Lipkin mentioned. Now, the last question for Zhang Wenhong, that in a number of occasions, both you and I think that others, especially Dr. Tom Frieden, mentioned that we need to be critical about vaccine nationalism, the so-called vaccine nationalism. So also that your writings, your media comment constantly talk about international collaboration. And but also that there's a concern within China, as I mentioned earlier, immunity gap. So between now and the end of June, the most optimistic view is 40% the Chinese population, so still lag behind compared with other. Are you concerned? So what China can do in this area?
Yes, I actually, we have a great concern about that. At the present in China, now today, just a total of almost 41 million doses. This data is from February 9th, have been delivered in China. The current vaccination pace is really low due to the outbreak control is so good in China in the very early stages. So the vaccine, however, I think the capacity itself is really, it's enough. According to our expectation, to the end of 2021, just I mentioned that the capacity, it will be increased to 2.1 billion doses. So I think we do not worry about the capacity in China. However, I just want great concerns about the speed of the vaccination. Given 10 million doses every day, 10 million doses every day in China, it will take up to 7 months to vaccinate almost 70% of the overall population. So you mentioned the 40% before June. I think it's really a great job for us to do that. If we just take 5 million doses administered per day, I think we can complete the task before June. So you can know that it's really a great concern for me. So another question about how about the world epidemics. If the world fails to control the epidemics effectively, I think China, we will have the gap, the immune before we vaccinate the whole country, the whole population. We will continue to be challenged by the imported epidemics. So China's current strategy is to promote the establishment of global immune barrier in an internationally coordinated framework, just like by COVAX or WHO. So meanwhile, we will ensure that our own vaccination strategies is gradually improved. So summarize, I will say that both China and the United States we as the major vaccine producers in the world, we have the responsibility to implement our own strategies to vaccine the mass immunizations and in the world, while we just not only take into account the vaccination by ourselves, we should take into account the vaccination of less developed countries. So this is why we take the current strategy in China. Thank you.
Thank you so much, and Dr. Zhang Wenhong. It has been always very enlightening to listen to your candid assessment. It's extremely helpful for both China and the international community. Now, unfortunately, the time has come to bring this conversation to a close. That I'm sorry that I could not accommodate all these good questions. This has been a fascinating discussion. I have learned a great deal from both panels. As we close out today's discussion, I would like to offer my deepest appreciation to our distinguished participants on both panels for spending their valuable time with us and sharing their expert insights at this perplexing and yet also very hopeful time. Now, on behalf of my colleagues at the Brookings, I would like to reiterate President John Allen's thanks to Tsinghua University for your collaboration. Joint efforts today by our two institutions across the Pacific will send, we hope, inspiring signals to people in both countries and around the world about the imperative of international cooperation to save lives. Finally, I want to thank our audience for joining us and for supporting common efforts to stop the spread of COVID-19 and realize a fast track to recovery. Be safe and be well. Thank you.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.